This is Dr. Mwiti. Welcome to my YouTube channel, the #1 channel where you learn medicine at the comfort of your house. If this is your very first time getting into this video, or if this is the very first time you're watching my videos, kindly consider to subscribe, hit the notification bell so that anytime I upload any new video, you will be the very first person to be notified about it. Today I'm talking about a condition that we refer to as the Polycystic Ovarian Syndrome, or in other words, the P.C.O.S. I am very sure maybe 80% of you have ever heard about P.C.O.S. Maybe like 30 or 40% of you have ever been treated of P.C.O.S. Maybe the doctor used the term P.C.O.S. or the Polycystic Ovarian Syndrome, and you never understood what Polycystic Ovarian Syndrome means. You never understood what disease is that. Now today I'm here to make everything easier for you and to make sure that you understand your health more than anyone else. And that's why I said this is the very best channel where you will get to learn medicine at the comfort of your house. Now I will just demonstrate to you. Today I will tell you, I will define what Polycystic Ovarian Syndrome is. I will tell you on the side of the signs and symptoms of Polycystic Ovarian Syndrome. I will talk about the causes of PCOS. I will talk about the complications. I will talk about on how you can diagnose this, the test and the diagnosis. I will talk about treatment of Polycystic Ovarian Syndrome. Here we go. What we mean by Polycystic Ovarian Syndrome, that's where I will begin. At first, Polycystic Ovarian Syndrome, the word polycystic, then we have ovarian and then we have syndrome. Okay, so the word polycystic means poly means two, then cystic means cyst. Then we have ovarian, this one is coming from the word ovary, and then we have syndrome. All right, okay. Now what we are meaning here, Polycystic Ovarian Syndrome, this is a condition that affects only females and it affects the ovaries. What we mean by this is the ovaries, in every woman there are 2 ovaries. So what we mean by polycystic, this is whereby the ovaries of a woman develops another internal ovaries containing some fluids, so all what we call follicles. Okay, so what we mean by this is whereby inside the main ovary there are other small particles inside the ovaries, and that is why we term to it as Polycystic Ovarian Syndrome. So even before I proceed, I would like you to know that anytime you have ever heard of you having Polycystic Ovarian Syndrome, or the doctor saying that you have a PCOS, what the doctor simply trying to mean is that inside your main ovary you have tiny follicles inside your main ovary, and that is the simple definition of Polycystic Ovarian Syndrome. Now, having in mind that we have already understood what we mean by Polycystic Ovarian Syndrome, now let us go into the signs and symptoms. The signs and the symptoms of Polycystic Ovarian Syndrome, most people cannot realize them because first thing, PCOS is painless. So if you have this Polycystic Ovarian Syndrome, there is no pain. But the very major signs and the symptoms, the major symptoms of Polycystic Ovarian Syndrome, number 1, we have irregular menses. This is whereby in every month as a woman you are supposed to menstruate. If it happens to menstruate throughout and every month, you are supposed to menstruate at least 12 times in a year. That is, every month you must receive your menses. In polycystic ovarian syndrome, this is whereby women, they experience their menses less than 80 times in 1 year. Or what we mean by this again, another sign is still on the irregular menses. This is whereby a woman can miss the period for like 4 months or more. That one is also under the irregular menses. So on irregular menses, this is whereby maybe in 1 year you have received your menses less than 8 times, or you have not experienced your menses for like 4 months consecutive. That one is one sign of polycystic ovarian syndrome. Another sign of polycystic ovarian syndrome, this one being the main sign of polycystic ovarian syndrome. Another one, it's whereby you present with signs of hirsutism. This is whereby there is hair growth. As a woman, you start experiencing some hair growth, and you have excessive hair growth. Another sign, it's whereby you have acne. What we mean by acne, these are the what you normally call pimples. That one is also another sign of polycystic ovarian syndrome. And another sign of polycystic ovarian syndrome, it's whereby people present being obese. All this one is being overweight. Okay, so that one is also another sign of polycystic ovarian syndrome. Okay, now these are the major, and we have also another one that people tend to think is a sign, but in fact it's a complication, and that is failure to conceive. Okay, that is failure to conceive, or infertility in other ones. Okay, that is all infertility. That one is also another sign of polycystic ovarian syndrome. So many people comes into the hospital when they have issues with irregular menses, when they have excessive hair growth, when they have pimples or acne. Others come with being overweight, and others come with issues with failure to conceive or infertility. When this polycystic ovarian syndrome is chronic and it has not yet been attended to early, some people might also present with high blood sugar levels. Sorry, they will present with high blood sugar levels. So this is when you check for your blood sugar, either be the RMBS or the FBS. This is the random blood sugar or the fasting blood sugar. These levels are usually high, but that one is when this condition has been there for some time. Now, having all these signs and symptoms of polycystic ovarian syndrome, now we need to talk about the causes. Now, what causes polycystic ovarian syndrome? This polycystic ovarian syndrome, the main cause of polycystic ovarian syndrome, in most cases it is not known. Okay, so there is no proven cause of polycystic ovarian syndrome, although according to research, there are causes that are believed, or there are conditions that are believed to be the main cause of polycystic ovarian syndrome. Now, if you have polycystic ovarian syndrome, what might be the main cause of this one? Now, that is where I am going next. Keep watching. Now, what causes polycystic ovarian syndrome? I said the main cause is not yet known, but it is believed that polycystic ovarian syndrome, it is caused by insulin resistance. Okay, it's caused by insulin resistant. What do we mean by insulin resistant? What is insulin? Because resistant, this one is just an English name, but what is an insulin? So this insulin, this one is a hormone produced by the produced by the pancreas. Okay, so insulin is just an hormone which is produced by the pancreas. Now, if this one is an hormone, what is the work of the insulin? How insulin works? This one being the blood vessels, and this one being the cells. This being the blood is this one being the cells. We call these ones as cells, and this one is the blood vessel. Okay, now I'm trying to explain to you what do we mean by insulin, and how does insulin work, and what happens that the resistance of insulin leads to polycystic ovarian syndrome. Now, the function of insulin, when the insulin is produced by the pancreas, the work of insulin, it gets into the blood vessels, and then it makes the sugars or the glucose in the blood vessels. It makes this glucose to move out of the blood vessels to enter into the cell so that it can give you energy. Okay, so that is the work of the insulin. So in simple, insulin makes sure that the excessive sugars in the bloodstream are being transported into the cells to give you energy. Now, what we mean by insulin resistance, this is whereby insulin is produced by the pancreas, but it cannot make the blood sugar to go into the cell, hence leading to accumulation of blood sugars into the blood streams. Now, when there is that excessive production of glucose, it makes a survival place for androgen hormones. Okay, so when there is a lot of androgen, that's where you can now easily get PCOS. The main culprit here is the insulin resistant. Another cause of PCOS is something that we refer to as low-grade inflammation. Okay, this is low-grade inflammation. So what we simply mean by inflammation, in every human's body there are something that we refer to as the leukocytes. Okay, all the white blood cells, the leukocytes or the white blood cells. So the work of these white blood cells is to fight infection. Okay, so if there is a long-grade inflammation, because of this long-grade inflammation, then it means that the body will be weak in fighting the body infections. Okay, and that one is also another thing that is believed to cause polycystic ovarian syndrome. And another thing automatically, it's another thing, it's an issue with the hereditary. So if maybe you have a relative who has ever suffered from PCOS, then you are also likely to suffer from polycystic ovarian syndrome. Now, we are done with the causes. We are now going into complication. What do we mean by complication? So what we mean by complication is, if this thing has not been attended to, what can happen? What does it happen after that? Okay, it's just like an example. Maybe if you have maybe an issue with a tooth that maybe is having a hole, you are supposed to go see the dentist for that tooth to be removed. If it happens that tooth has not been removed, it might cause infections that may result into swelling, that may make even a lot of abscess accumulation. So that one is a complication. So what we mean by complication is, what are the adverse effects of this condition? So if this condition is not treated, what is likely to happen? So number one complication of this PCOS, and that is the major thing that makes people to come into the hospital. Because remember, I said PCOS is painless. So what makes people to come into the hospital? Because people come into the hospital with this condition, and on the process, that's when we realize this person is having PCOS. So number one complication is infertility. Okay, infertility. So many women comes into the hospital with issues of, doc, I have tried to get pregnant for like 3-4 years without success. So after you have done your analysis, after investigations, that's when you later on realize that this person is having infertility. Another complication is type 2 diabetes. Okay, so type 2 diabetes. What do we mean by type 2 diabetes? Remember we said the work of insulin. Insulin, if there is insulin resistance, then it results to excess accumulation of sugars or excess accumulation of glucose into the bloodstream. So if there is this excessive accumulation of sugars in the bloodstream, what that does, it causes diabetes mellitus. Okay, now that one is also a second complication. Another third complication, a person is in higher chances of acquiring endometrial cancer. Okay, so we write it just medically, we say you are likely to get endometrial cancer. Okay, so that's why we write it. That one is CA endometrium. So CA endometrium simply means is the cancer of the endometrium, right? That one is also another complication. Another complication that you are likely to suffer from is obesity. Okay, because of excessive sugars in the blood system. Remember, too much sugars causes weight gain. If you gain weight rapidly, then it means automatically you get to be obese. That one is also another complication. Okay, another complication of this one is depression. Okay, you are likely to get depression. Another complication of this one, you are likely to suffer from ovarian cyst. Okay, you are likely to suffer from ovarian cyst. That one is also another complication. So the complications are very many that you can get from PCOS, but these are the most common. But the very most common are this one: infertility, type 2, diabetes mellitus, ovarian cyst, and in most cases depression. Like for example, maybe you have been married for 4 years, you fail to get pregnant, your husband becomes notorious, your husband becomes troublesome, you are most likely to get into depression. Now we are done with the complications. Now let us check. After now we are done with the complications, let us now check on the text and diagnosis. How can we diagnose polycystic ovarian syndrome? This polycystic ovarian syndrome, number one, you can just diagnose it by physical exam, just by checking on you, even without doing any lab test. We just check you, maybe on your cheeks, maybe you have some hair growth, you have lots of pimples, you have excessive hair, and you just present with some conditions. The androgen hormone that is found in men, when it's too much in you, then you present with some presentation. So number one, even before we go to lab test, we can diagnose it by physical exam. Another diagnosis technique, it's whereby we can decide to do the blood test. Okay, so this blood test, we check on the hormones. We check the level of progesterone hormone, the level of estrogen hormones, and the level of androgen hormones. Okay, so if there is a lot of androgen hormone, then this one mimics the chances of having polycystic ovarian syndrome. Another test, and this is the most used, it's whereby we can have imaging. Okay, so and this is the basic that we do, that almost every hospital does when they suspect you have polycystic ovarian syndrome. They will just do imaging. And what we mean by imaging, we are talking of the abdominal, pelvic, we are talking about abdominopelvic ultrasound. Maybe when you go there, the doctor decides to request for a abdominopelvic ultrasound. Okay, now these are the most imaging techniques. Now we are done with that. Now let us go into the treatment as our last bit to cover about this one. Now I want to remind you one thing, that polycystic ovarian syndrome, I want to remind you that the P.C.O.S does not have any cure. Sorry because of that bad news. P.C.O.S does not have any cure. There is no cure. I will write this one in capital letters. P.C.O.S does not have any cure. But what we do in P.C.O.S, we just manage. So this is just the management. How do we manage P.C.O.S? Number one, remember we said it is caused by insulin resistance. So number one, what we'll do, the number one management is whereby we will control insulin. Okay, so we have drugs that we give to control your insulin, so that we will prevent you from getting the type 2 diabetes complication. So we will control insulin levels. Number two, if you are trying to get pregnant, we will give you medications. Most of the time we can decide to give you the COC pills. That is maybe so that we'll try to balance, so that we introduce estrogen and progesterone, so that we'll try to balance the effect of androgen hormone. We can give you the combined oral contraceptives. We also, if you are trying to get pregnant, we give you the fertility ovulation boosters. Okay, we give you ovulation boosters, or these are the fertility drugs. Okay, so we also decide to give you the fertility drugs, and we also advise you on dieting, because if you are already obese, we must advise you on dieting, on the food stuffs that you can use, so that you will at least be over some lesser weight. So that is how we manage P.C.O.S. But even before I conclude, and even before I come to an end of this topic, I will let you know that number one, P.C.O.S, what the doctor means by you are suffering from P.C.O.S, and I want to repeat this because I have seen many people ask me, Doc, what is P.C.O.S? What does it exactly happen with the P.C.O.S? I said you have two ovaries. Okay, inside these ovaries there are follicles in it. What happens when you have P.C.O.S? Another tiny ovaries develops inside. Okay, so what it simply means ni kama kwa mayai ya kuku, this one being the main egg kwa mayai ya kuku, when you break inside, instead of you getting and seeing the yolk and what, unaenda unakuta kwa hiyo mayai kubwa kuna tumayai twingine tundogo ndani. Okay, so kwa hiyo tu mayai moja ya kuku hiyo unajua. Okay, now this being the main egg, ukienda ukivunja ndani unakuta kuna tumayai twingine tundogo. So that's what basically we mean by P.C.O.S. Okay, so that's what we mean by P.C.O.S. Because remember I said poly, this means two. Okay, then cystic, this means just a cyst. Sawa. So that's where the name polycystic comes from. Then ovarian simply means the ovary. So what it means that in your ovary there are cysts which are more than one. Simple. That's what we mean by polycystic ovarian syndrome. So what I want to let you know is that in case you have any issues with getting your menses, in 1 year you have received your menses less than 8 times in 1 year, or maybe you have missed your period for 4 months consecutively, you start experiencing some kind of weight increase, maybe you start developing issues with too much pimples on your face, maybe on your chest, on your breast, and you also start realizing that you have some hair growth maybe in your hands, on your cheeks, and what, and you have missed your periods for like 4 months consecutive and you are not pregnant. Maybe you have issues, other tiny issues with maybe some signs of blood sugars. I advise you that you get into the hospital as soon as possible so that you will be checked. You can be checked for polycystic ovarian syndrome. But one thing that I want to remind you is polycystic ovarian syndrome does not cause permanent infertility. So with the polycystic ovarian syndrome and with management, you can still get pregnant and desire your own children. Okay, and now that marking the end of my video, I still again kindly request you that if this is the very first time that when you are coming across this video, kindly consider subscribing. Subscribing does not even need anything much. It's just clicking on the subscription, and when you subscribe, kindly I beg also remember to press the notification bell and then select all, so that anytime I update any video, you will be notified about it. So until next time, keep watching this one. You also comment your feedback, like the video, and you can also share with your friends. Until next time, bye.